work in Boone and Story County. I like the ideas that you talked about earlier of trying to bring as much personal responsibility into healthcare decisions and try to work on that cost side. But the part that I find more attractive about the expansion of Medicaid is the ability to insure more people. Seems like there were significantly more people would be covered under that. And wondered if there was.
Yeah, the register is wrong on this. Our plan covers everybody, but it's not the Cadillac plan where it's free. That's the difference. Our plan does cover all of them. We cover from up to 100% of poverty under our Healthy Iowa plan, and those above, under the federal exchange program, would be able to get subsidized insurance. So everybody's covered under our plan.
Is that what you were referring to?
Is that what you're?
Cut you off. Sorry.
Well, I just wondered if there was a way to blend those, since the state of Iowa will be writing its own Medicaid plan. It does write its own Medicaid plan.
Yes, and that's the reason why we've gone the direction we have. You may have heard that I met with Secretary Sebelius, and we had three choices under Obamacare. Do we want to be a state exchange, a partnership exchange, or just defer to the federal government? And we carefully looked at it and tried to get as many answers as we could. We didn't get all the answers we wanted, but we finally said of the three options, we think the partnership one is the one that is best, because our insurance commissioner could still set the regulations for the insurance part of it, and our state director of the Department of Human Services would regulate the Medicaid side of it. So that's what we chose to do. And we've gotten a tentative approval for that portion of it. And under our Healthy Iowa plan, everybody over 100% of poverty would move to the exchange. Those under 100% of poverty, the state would ask for a waiver on our Healthy Iowa plan, and we would use a combination of state dollars, federal dollars, and money that presently has been used under the Iowa Cares program, under this new program. But it would cover everybody. Now, it's not the same as the Medicaid program, but I can tell you that under the Medicaid program, it's a 1960s model that was based on basically when the employers paid all the health insurance, and this was having the government pay the whole cost of it. The problem with that is you have people on Medicaid that will go to the doctor so they can get a prescription rather than go and get what you can get over the counter, because that way the government pays for it, it's free. Same thing, they go to emergency room to get services that you and I would go to our physician's office for. We're trying to prevent some of those kind of things that have been, and I can tell you the history of Medicaid. And I was governor before. In the 80s, Medicaid costs were out of control. In the 90s, Iowa was one of the first states to do welfare reform, because people on welfare also get Medicaid. And we said, it makes no sense to support people on welfare for year after year after year. So let's provide job training and child care assistance and help people move from welfare to work. We got a waiver to do that. I got that through the legislature. We had to go to Washington with Secretary Donna Shalala at that time. It was quite a battle, because she said, well, I want you to only just put 5% in this new system and 95% of the old system. We said, no, we want 95% of the new system, 5% of the old system. We'll demonstrate it works. We did, Wisconsin did, Michigan, many other states. Then we were able to get the Congress, this was back when Gingrich was Speaker and Bill Clinton was the President, to pass welfare reform. The result was, in the 90s, we reduced the welfare rolls in half and controlled Medicaid. So when I left office, we had 250,000 people on Medicaid, and it was less than 12% of the state budget. I come back 12 years later, we now have 400,000 people on Medicaid, and it's nearly 18% of the budget. And this year, because Iowa's done a better job of managing our costs than other states, we have to pick up a larger share of the Medicaid. So our costs go up. $52 million was paid by the federal government for Medicaid last year, going to be paid by the state of Iowa this year. So when people talk about the expansion of Medicaid as free money, well, it's not free money. Over the weekend, you may have seen Michael Bloomberg, who is no conservative, the mayor of New York City, and he basically said this country's got to get its financial house in order, and the things that are driving it are the entitlement programs, Medicaid, Medicare, Social Security, and the interest on the national debt. Now let me just mention interest on the national debt and why I'm really concerned about that. Stock market just hit a new high. When the stock market does well, and then we're going to be faced with the potential of inflation, how do you control that? Higher interest rates. Right now they've kept interest rates rock bottom low. Every 1% that interest rates go up, the cost of financing this $17 trillion national debt goes up by $170 billion. $170 billion. Every 1%. So what I'm telling you is, and in 10 years, with the growth of entitlements and the cost of financing the national debt, talk about sequestration on domestic discretionary spending and national defense. There's no money left for any of that. 10 years from now, entitlements and interest in the national debt use up every single dime. So that tells me the federal government may have promised they're going to be able to do this, but there's no way they can keep that promise. And I want to protect the people of Iowa from getting stuck with the federal rules that say you have to maintain. They have what they call maintenance of effort. Once you buy into their program, you've got to maintain it. Even though they may reduce their share of the funding, you've got to pick it up. That's the reason why I'm skeptical.
Governor, we have time for one more question.
Okay.
And Brad, I'm Superintendent of Schools here. I wanted to first thank you for the question about STEM programs. We were recipient of 6 of the grants. We've taken those grants and we've built STEM programs within the school. Next year we are going to have a new STEM program and a STEM teacher at our middle school. It's building into our students in preparation for the high school experience, which will be expanding STEM classes this next year. What I'm concerned about is, as Dr. Anderson was mentioning, we're facing reductions under 2% allowable growth. One of the first things that will be cut, if we have to cut, is the STEM program. And we have continued in working with the School Administrators of Iowa, the Iowa Association of School Boards, Iowa State Education Association, to tell you the importance of focus on allowable growth. I want to reemphasize that importance. I've been in the state 14 years after living here as a child and then moving away and coming back as a superintendent. Since 9/11, funding has consistently reduced or been at a maintenance level for 12 years. And I've never faced an economic situation in the schools like we're facing now, even though we're doing many of the things that you suggested earlier.
Well, I'm trying to, first of all, I know that Culver did a 10% across the board cut in 2009. I know that in 2010, they underfunded the school aid formula by $216 million. That's the mess that we inherit, okay?
Correct.
In this state, we're using a lot of one-time money for ongoing expenses. So the first thing I said, we're going to restore stability and predictability. And so, but we fully funded the school aid formula. We didn't provide any allowable growth. The second year we did. But we also want to reduce our dependency on property tax. That's why we want to replace allowable growth with 100% supplemental state appropriation. I don't understand why 2% of additional state funding on top of what you're getting last year is a reduction.
2%. When we do a budget every year, there are some major factors that play into it. One of those is negotiations with teachers. Another is
Okay, we can't help that. Well, really, we can't. I just negotiated with state employees. I went through this whole thing, and I'll tell you. Yeah, and we got a 0-0 increase for the next 2 years. Yeah, that's what we did. And I'll tell you, the ASME union, they really love me. but I will tell you, we negotiated the way we need to protect the taxpayers' interests, you know.
Well, Governor, respectfully, we can get into a negotiation debate about that. But what I'm saying is that we as leaders in education in Iowa have been working very hard to do the things that you have suggested with our budget. We've been working very hard to increase the quality of education in our schools and support the programs that you're offering. We've also been saying 4% of all the growth is what we need. We are not able to maintain our current programming under 2% all the growth.
Well, I think you do need to also look at some other expenses and ways that you might be able to find more efficient ways to do things, just as we have in state government. I would encourage you to do that. At the end of the day, you know, my goal is to get the education reformed. We get the education reforms, we'll see how much additional money we can provide. But also, in order to maintain a budget that is stable and sustainable for the long term, we're looking at it through a 5-year lens. So whatever we do this year, we've got to know what the impact that has. And you know, in our education reforms, it ramps up over the next 5 years. And every year we're going to be putting more money into it as we put this these new options for teachers. And so we want to make sure we've got enough revenue, we have enough resources to be able so I will not make a false promise. There's a lot of politicians that will promise you everything, and then they will give you an across-the-board cut or pull a rug out from you. That's not the way I operate. I would rather under-promise and over-deliver. When we said we're going to restore stability and predictability, we did it. And now we're building on that. But there are those in the legislature who want to go back to double-digit spending increase. We can't afford that. You know, we may have 6% we may have 6% growth in revenue this year, but historically 4% is considered pretty good. And we got to be very careful about not getting into the pattern of the federal government where they're spending 35% more than they're taking in, and they're just adding to the national debt. And the day of reckoning is going to come on that, and it's not going to be that far off. It's going to happen within the next 4 or 5 years because it just can't be sustained. Well, thank you all very much. And these decisions are not easy. We want to do the best we can. I think you're lucky you don't live in Illinois or California. If you were in Illinois, you'd be getting your school aid payments to 20 months late. If you lived in California, you'd see massive cuts, real cuts. Not as big a smaller increase than you'd like. But so I would like to say that I think we've got Iowa going in the right direction. We'll never have enough money to meet everybody's interest, but we want to do the best we can, and we do appreciate all of you coming out and the opportunity to have a really open and frank discussion. Thank you very much.
Thank you.
Thank you.
Lieutenant Governor Reynolds, we really appreciate you taking the time to come to Boone on such a snowy day. And I want to thank everyone here. There's 2 groups of people here who I didn't address when they first come, and they're probably the most important people in the room. And that's the private taxpayer sector, and it's also the business sector. And there's very good representation of all those people in the room today. We truly appreciate it. Thanks for taking the time out of your day today. Great questions, great conversations. Thank you, and have a good afternoon.